Hi, everybody. I'm here today to speak with Dr. Yerman. She's a chiropractor. She's amazing. I love her, and I'm excited for you all to get to know her. See you in a minute. Hi. I am so excited to see you.
It's good to see you too.
Okay, so Dr. Deb,
Yes.
tell me, how long have you been doing this? And just tell me a little bit about what you do and how long, and
Okay.
you're on.
I've been a chiropractor for not quite, but almost 40 years, about 38. I started very
Oh
young,
my gosh.
and I have been loving it all along. I have a wonderful little practice here in Encino with the most wonderful patients. I run my practice a little different than most in that I do short-term care. So I have people that come in pain, and I like to get them out of pain and also then send them back to their life, and they just come back when they need it if they're having any discomfort. It's been very successful for me and for the patients with the different techniques that I use, which changes individually with each patient.
So that, I noticed that. Like one pain doesn't necessarily mean it's that pain. It means it might come from another place.
Right. Oh, that is so true. And that's why some of the new technologies lead us to the area. So we do treat the area of pain, of course, but sometimes it can be on the opposite side of the body or coming from the neck that's affecting the low back. So we always make sure that we check all of that.
And would you say since people started using computers and phones and that you're starting to deal with something a little different than maybe you dealt with, let's say, 15 years ago?
Oh, it's so upsetting to see. We have so much, even in the kids with their backpacks and their phones always looking down. We're supposed to have a normal curve in our neck. And when we have our head down or we're on the computer like that, it actually is like a trauma to the body. People are having more headaches. We have a lot of different exercises and bringing consciousness. If you're using your phone, instead of looking down, just lift your arms up a little bit, just so that you bring your eyes straight forward can make a huge difference. But yeah, it's really been a problem.
And would you say you have a specialty?
My specialty always has been headaches. I really love getting rid of people's headaches because I don't think I could stand it living with headaches all the time. So I do that, but we have really good results. I'd like to say that I take care of a lot of women's issues, but I have a lot of families come in and a lot of my young athletes that play baseball and basketball, and they start with me pretty young because it makes a difference in their game and how their body feels. And so that's hard to say. I guess just a lot of sciatic pain, a lot of neck pain, a lot of rehab, teaching people what to do as far as, how to get their head back up on their body right.
So let me ask you, when you say short-term care, now that could be different for everybody, but what exactly does that mean?
Well, in chiropractic, we do believe that when you get adjusted, that you should always get adjusted because we're humans and we do a lot of things and we hurt ourselves. And I found that patients really, what they want is to get out of pain and get back to their life, that we live in the middle of Los Angeles here and everybody is really busy. So even though I do believe that it's good to get maintenance care and it's good to get treated in chiropractic, that it keeps everything moving and healthier, what short-term care is that if you come in with a problem, I will address the problem for you. Now, you might then say, but my knee or my shoulder, and then we go on to another problem. But if you come in and you have headaches or neck pain or sciatic, and that's what you want treated, we treat that, we get you feeling better, and then we release you from care.
And then you pretty much, as I've noticed, treat the whole person.
Yes.
So it's not just one area that might hurt. I mean, there might be a whole slew of things. They had a car accident, or they're walking in a certain way, or they're emotionally distraught. I mean, there's a whole slew of things that cause our bodies to ache. Can you just talk a little bit about that?
Well, absolutely posture I get my patients crazy. It's so important once you start getting treated to strengthen yourself, to take notice of yourself. And what we think of as good posture used to be you get up against the wall and you make your body straight. Well, it's not that anymore. We know that there are different ways to teach people that make it a little bit easier. So there's posture. Stress absolutely affects us chemically. It affects our digestion. It doesn't mean that stress causes our pain, but stress we all know, plays a big part of, how healthy do we feel? How good do we feel? I'm a believer that we want to feel good. We want to wake up in the morning and have good energy. And there's a lot of ways to do that. And we can change certain things like increasing our water or decreasing the sugar or just getting adjusted or find out what is the right exercise for you. A lot of people start to exercise and they hurt themselves. Well, why? We have to figure that out. We have to figure out what's underneath that. And then what do we do to start getting you stronger?
Must feel so good to sort of get somebody out of pain.
Oh, I love it. There's nothing for people that have had headaches for 20 years and they come in and they don't have headaches. I mean, literally, I have had it happen that it's a year later and I'll say, do you have any headaches? No. What headaches? There's just nothing like that. It really is. It's very rewarding.
Would you say that's the best part of your job or your career or your life?
I have so many best parts.
Okay,
The connections with the patients I have. I love when patients come in and they go, "Oh, you're a chiropractor. Don't get near me. I'm scared. My wife made me come," or whatever that is. I love that because they're the ones when they start feeling better that they go out and they tell everyone. I love the connection. I have the most wonderful person who runs my office, Queenie, that I get to see every day when I come in, and getting the patients well. And if patients don't get well, or if there's some reason that we're not getting to it, I like to help them find the right answer or refer them out or, that kind of hand-holding I really enjoy.
So in a moment, Queenie's going to come in, the lady of the office, and you're going to show us some of your, we can call them accoutrements.
Adjustments. It's adjustments.
Okay, we'll get Queenie. Hold on.
Is going to be doing an adjustment on me on this incredible table.
Okay, so just lean forward,
Okay.
and the table takes you down into a lying position, and that way we know everything is perfectly in alignment and straight, so we can't get any bad readings. And one of the techniques that I use is called an activator. So it's a fast force, and if you can come over here, Queenie, for a moment, and just take a look at the difference in the leg length. It's pulled up a little bit on the left there. And I'm just going to bring the legs up. Okay. I'm going to be using an activator, which is this. It's a fast force. It doesn't hurt. It's very specific. And we're going to do just 6 points in the pelvis. Now, the patient doesn't feel too much being done. And so it's hard to even imagine that something is happening, but it actually does. And then come on down here. And we're going to just take a look, and we just want to see with this Deerfield test if we get a balance. And we do here, and then I'm going to bring your legs up. Good. And this is a computer called the IQ, neuromechanical, and it looks very intense, but it's not. It takes a reading on its first click, and then it reads how many clicks it needs to go. Now, when it just turns off like that, it means that this area is so tight that we didn't do anything. It didn't get movement. So I'm going to turn it up a little bit. And when we get that beep sound, we know that we've got what we want. And so we don't miss anything this way. So thank you very much, and bye-bye.